The biggest problem, man, I think happened to man was the use of antibiotics. That started this accelerating the suppression of man's lymph system, especially the sulfur drugs. This is another crime that we've used. We're trying to kill the messenger. There's times where bacteria is having a heyday, absolutely. But in reality, it's all about the culturing medium, not about the bacterium. No one would go to a septic tank and kill the bacteria in their septic tank because their septic tank was backing up and sewage was overflowing in their house. And that's basically what most people are experiencing, pain and swelling and tumors and boils and cysts. They're experiencing the sewage backing up in the house. Well, you got to expect bacterial action to happen. That's essential to happen in the body when that is. That's what bacteria's job is sewage, breaks down sewage. So you don't kill the messenger for the sake of killing. I bet you if you look back from the advent of antibiotics, the death rate is probably well in the tens of millions of people have died from the use of antibiotics. We think that's good? My problem at the moment involves my right ear. I am generally healthy, except a couple of months ago I got sick with flu, and my ear filled up with fluid and pressure. Well, see, that's that lymph, and that's why we want to get that kidney on that side. That's going to be, what side is that? Your right ear. That's going to be your right kidney. Is going to be the weakest there. I was deaf in that ear for over a week. I went to my GP, and she prescribed antibiotics. See, and that's the thing. So the problem with antibiotics is, unfortunately, they suppress the lymph system, so that shuts down your symptoms, and you think, oh, well, that was good. Now we can blame the bacterium for this. And bacterium is not medical terminology. Bacteria is a natural appearing single-celled organism that sucks up sewage. So I don't know what to say about that. But I can tell you, your lymph system's backed up really bad. Now with the antibiotics, you still have to, you got the problem, but maybe even worse, because now they suppressed your lymph system's ability to drain itself, and you're killing the bacteria. And remember, your lymph nodes are supposed to be full of bacteria, and when medical doctors kill bacteria in lymph nodes, that's borderline criminal in a way, because I'm going to tell you, you kill the bacteria in the human body, you're going to put them to death. The cancers are going to roar on you. They're going to put them to death because you have to have bacterial action. I don't know what you guys are thinking. You got to have bacterial action in the body. Remember, we do probiotics. You do antibiotics. My ear infection eventually healed. You know what? I would say that you suppress that with the antibiotics, and you really need to revisit a detoxing. Really dig in, sweetheart, and get your body cleaned up. Let me see here. Okay, so we started out with bronchitis, then it went to laryngitis. Remember, every time you suppress with antibiotics, the next experience is deeper. Simple cold and flu, sinus congestion, goes into bronchitis, goes into pneumonia, doesn't go in. It's just, when you suppress congestion, remember you're constantly creating congestion. And especially if you're eating the same way that's creating the congestion, like with the dairies and the things like that. So everything is going to get worse and worse and worse and worse, and it does. Now, someone asked me about, would you expand on your opinions about probiotics? No, don't like them. You don't have to seat bacteria. Bacteria seats in the body per food you eat. You can't keep microbes out of you. I've been a builder for years and building new homes with new septic tanks, and you don't have to worry about seating bacterium, not at all. And I find that some of the probiotic formulas just causes nothing but gastric distress. So really, these things are supplements you buy, and okay if you want to. Personally, don't recommend them, don't use them in my practice, and never have a problem getting people well in Wellville. Dynamically healthy in Wellville, matter of fact. One guy came in, he was a paraplegic, and his wife called and said, well, my husband threw 4 blood clots and had a heart attack. What'd you do to him? Well, I'm thinking, well, God, what did I do? You know, it's like, because I know herbs don't do that. I know raw foods dissolve blood clots and everything else. So I said, we actually do a cationic environment where allopathy creates an anionic environment on top of an already anionic environment. So I said, you know, so I went down, visited him in ICU and everything, and I told him, come in, we'll talk about it. I don't know. So we came in, I was saying, you know, this, for some reason I just said, this sounds like something an antibiotic would do. Sure enough, he kind of looked at his wife like, what in the hell did you do to me? Well, he got a little UTI during the detox, which is common, especially with quads in Paris, so he ran to the medical instead of coming in here, and he gave him Cipro. That pharmaceutical company that makes Cipro, why isn't the FDA putting them up on the chopping block and making somebody go to prison? Because it's been killing people for years, and they know it. They know Cipro kills people. It's in the PDR. This question is about colloidal silver and ionic silver. I do not recommend isolating silver. Not at all. Look at the man that turned blue. A lot of people are getting blue fingertips and stuff. I do not recommend isolating chemistry at all. We have too many great herbs as antifungals. And healers, nothing Gout beats golden seal and comfrey for healing. And yet, you know, people are please don't do the silvers. That's not a way to go to health. Russell, you know, that's not a way to go. A lot of claims made about a lot of things, but you're playing with chemistry, and I personally never recommend isolating chemistry and playing that game. Far-reaching effects, and so don't do it, in my opinion. You really want to go to the herbs. That's where you find the goodies. Sulfur is definitely antagonistic to the different chemistries of what? You know, when it's an acid, you can just about figure that it's antagonistic to calcium, because that's the first thing that the body draws to fight these. So it's possible that with a built-up sulfur in the gut from long-term antibiotic use, that you could lose connective tissue function in the wall of the bowel. Hard to say. One thing we know about sulfur, it's an irritant, it's inflammatory, it causes acid reflux that you can't get rid of unless you get rid of the sulfur. It is a fungal proliferant. It highly suppresses the lymph system. And I think when people say antibiotics, I think you have to understand that there's more than just an antibacterial action to an antibiotic. Whenever you bring in excess chemistry of one kind, it's going to be antagonistic to another. Remember, we talked a lot about isolates and the fact that you can't use isolates in a world where chemistry is synergistically bonded and ratioed. Properly ratioed. Man doesn't know how to properly ratio chemistry like God does. We're lost. We have as many opinions as we have minds.
Another problem with sulfa drugs is that they increase the risk of developing kidney stones. In this study, scientists analyzed the health records of 13 million adults and children in the United Kingdom who saw their doctor between 1994 and 2015. The data included the treatment history of 26,000 individuals with kidney stones, which the team compared with the health records of almost 260,000 people who had not developed kidney stones, the controls. The analysis found that several types of oral antibiotic, more specifically sulfas, cephalosporins, fluoroquinolones, nitrofurantoin, and broad-spectrum penicillins, were linked with an increased risk of kidney stones, even after controlling for factors such as age, race, sex, urinary tract infection, and other medications and other medical conditions. The increased risk remained significant. Those who received sulfa antibiotics were twice as likely as people in the control group to develop kidney stones, while the individuals who received broad-spectrum penicillins were 27% more likely. The association was found to be strongest among children and adolescents. The increased risk of kidney stones remained high even several years after the participants were exposed to antibiotics, but the researchers did find that the risk decreased over time.
Someone also called me and asked me about MRSA. Now, MRSA Yeah, you know, when you play with antibiotics, you get bacteria that starts to do like this to you. So this is ladies worried about MRSA and whether our parasite M will deal with MRSA. Absolutely deal with MRSA. Matter of fact, parasites like bacterium do not get this anti-herbal parasitic intolerance that I've seen. So you should do well with MRSA. We've had many cases of MRSA, very common in nursing homes and everywhere else, and she's worried about it. And it's like, no, detoxify your body. Remember, this is about culturing mediums and clean the culturing medium out. You know, you can't just think of parasitic, you have to think of culturing medium. Why do I have a growth factor? The same with this poor girl that's losing half her body with this flesh-eating bacteria. My current problem is that I have eczema on big areas on my body, legs, arms, abdomen, and back, which is still spreading, and I am not able to stop it. That means that you have not gotten in deep enough, and you haven't got your kidneys filtering, and this is going back to kidney filtration. Pee in a jar and take a look at your urine, because there has to be sewage in it to be filtering. You wouldn't think something as minor as a lack of filtration could cause such a problem, but it's a big problem. You have to eliminate waste. You don't eliminate water and some minor chemistry. You eliminate waste from 100 trillion cells, and think about this. And you don't want your skin to primarily do it. And that's what's happening with you, is your skin is primarily being your elimination organ. And that means your kidneys are not doing it for you. But that would also explain the lungs and things like that as well, given that dairy products are immediate congestion with lungs up. There are many small weeping holes in my skin, and that weeping is interstitial fluid. That's lymph. That's mucousy lymph fluid, and that's what I'm saying. That's your lymph system, and it should be opened up and going the other way. The affected areas are very itching. Well, I'm sure you got a lot of fungus in there as well. You know, by the time your lymph is down, you realize the adrenals are down. By then, you start to see blood sugar problems. These are universal problems that we all face. The dermatologist told me that it is not caused by moles and want to use antibiotics and hormones for healing. Now, no one that I know of through all these years of acne and cystic acne and psoriasis ever gets cured of it by taking antibiotics and through dermatologists. I've never seen a dermatologist. It can go away temporarily when you get the bacterial action and you're suppressing with the bacterial action of an antibiotic and the lymph suppressing factors of the antibiotics. Yeah. Then you're going to see, you can see, but there's going to be a point where you're too chronic. There's nothing to suppress anymore. That is all, it's just because of the use of antibiotics. The seriousness of using antibiotics on this, again, is killing the bacteria in the lymph nodes. You do that and you're setting yourself up for serious, serious problems. Bacteria are not after the cells, they're after the sewage in the body. You got plenty of macrophages and monocytes. You got plenty of cells that eat other cells up, you know, to take care of cells that are damaged. But you got the bacteria, particularly for the trash, and that's essential. Killing them has never been a smart idea, ever.